What cutting-edge research improves CF lung graft survival? Imagine a future where lung transplants for cystic fibrosis patients last longer and improve quality of life. Scientists are making real progress in understanding how to achieve this goal. One of the most exciting areas is studying chronic lung allograft dysfunction, which is the main reason long-term grafts fail. This condition is a form of chronic rejection that slowly worsens lung function over time. Currently, there are no approved treatments to prevent or reverse it, making it a big challenge for transplant success. Researchers are now using advanced techniques like molecular profiling of lung tissue to better understand this problem. They analyze gene activity in the transplanted lungs to identify different biological patterns, called endotypes. These patterns can tell us why some patients develop worse outcomes and help us find early warning signs. The hope is that, by detecting these molecular signals early, doctors can intervene before lung function declines. This approach could lead to personalized treatments that prevent or slow down the progression of chronic rejection. Another promising area involves matching donors and recipients based on age. Studies show that younger donors tend to produce better long-term results, especially for patients between 18 and 60 years old. When the donor is younger than the recipient, the chances of graft survival improve significantly. This information supports more tailored donor selection strategies, which could help improve outcomes for cystic fibrosis patients. For those who need retransplants, recent research suggests that doing a double lung transplant offers better survival chances than a single lung. Patients receiving two lungs tend to live longer after retransplantation, with median survival around 4 years compared to just 2 years for single lung procedures. This evidence encourages transplant teams to consider double lung retransplantation whenever possible for better long-term results. Advanced machine learning models are also transforming how we select transplant candidates. By analyzing pre-transplant data, these algorithms can predict which patients are most likely to survive the critical first year after surgery. They classify candidates into high or low risk with impressive accuracy. This helps doctors make smarter decisions about organ allocation, ensuring that those most likely to benefit receive transplants. It also helps manage expectations and plan personalized care. It's important to remember that cystic fibrosis patients generally do better after transplant than many other lung disease patients. They tend to live around 10 years after the procedure, thanks to their younger age and overall health. These research advances, from molecular studies to better donor matching and predictive tools, are all working together to improve lung graft survival. They aim not just to extend life but to understand the biological reasons behind graft failure and intervene early. Always consult healthcare professionals for personalized advice, but these developments offer hope for a future where lung transplants are more successful and lasting longer for people with cystic fibrosis.